For most of us, a pinched nerve can be pretty annoying. For a diabetic, a pinched nerve in the foot can eventually lead to amputation or even death. Dr. Dellon is a plastic surgeon who developed a surgical technique to decompress nerves and prevent such problems. I talked to him about the procedure.
When a nerve is compressed for a long period of time, the sensory nerve fibers stop working, you lose feeling in your foot, many people have pain, and when you lose feeling in your foot, you're at risk for ulceration, infection, and 1 out of 6 people with diabetes who develops neuropathy will have an ulcer and then go on, 1 out of 6 of those, to have an amputation.
And so your innovative approach will perhaps keep a lot of folks, hopefully, from having to think about amputation or even have it carried out. This nerve decompression works how?
Well, I'm very excited about this. I think most viewers will know what carpal tunnel syndrome is, when a nerve that's this big is pinched in your wrist. And people know that if you operate and open the covering of the pinched nerve, the nerve wakes up, numbness goes away. And we've taken that same approach to the feet. We identify in people with diabetics and symptoms who have numbness and tingling areas where the nerve is compressed in their ankle, their knee, and the top of their foot. When we open up these tight places, life comes back into the nerves, and no one we've operated on since 1982 has had an ulcer or an amputation.
So you feel pretty confident about the results. What are the potential side effects?
Well, not everybody gets a great result, but 80% of the people do. 80% of the people, when we tap, if they feel tingling in their fingers, will have a chance to get a good result. Because we operate on the foot and the stitches are near the ankle, we do allow people to walk right away. The surgery is an outpatient procedure, and when people can walk right away, the stitches may pull through the skin. So a potential complication is that the wound may not heal. About 1 out of 100 patients will have this problem, and the wound will heal slowly over 5 to 8 weeks.
And so again, how can a patient kind of detect themselves whether there is a nerve problem, whether by way of the wrist or even the ankle, as you were demonstrating?
Well, it's a very exciting thing. If you take the same idea about the hand and you apply it to the foot, we know that the nerve in the ankle crosses right here, and if a patient at home crosses their leg, if they're a diabetic and they wonder if they have a problem, they just will tap along their ankle, and if they feel something go into their toes or into the arch of their foot or even their heel, they'll know there's life left in that nerve. We can release it, and the patient will have an 80% chance of relief of pain and recovery of sensibility in their foot.
All right. Now, you give a very rosy outlook on this treatment, but not everyone is on board with it, namely the American Diabetes Association. They're using words like unproven therapies. How do you dispute that?
Well, I'm a plastic surgeon, and the research that I have published and that the other doctors I've trained have published appears in the surgery journals. The medical doctors are just coming to read what we've written. The medical doctors actually agree that if there is a compressed nerve in the foot, the ankle, or the knee, the nerve should be decompressed. The American Diabetes Association, quite rightly, is very conservative, and I agree with them that not every diabetic should have this operation. But if you're a diabetic with a nerve compression, I believe the medical doctors would agree with my statement that that nerve should be decompressed.
Dr. Dellon, thanks so much for your time. And a look at the top stories and In the Money when we come back.